Thank you so much for joining us for our March CE event in our monthly child and adolescent professional development series. I'm Donna Bartlett, and I'm a member of the outreach team at Suncloud Health. Suncloud Health provides integrated, nuanced treatment with residential PHP, IOP, and virtual services for adults and PHP and IOP for adolescents ages 12 to 18, focusing on treating the whole person, and we have sites in Naperville, Northbrook, and Lincoln Park. If you're interested in learning more about our services, my and Lori, who's not able to be with us today, contact information will be included in the last slide for you. To make a referral, you can contact one of us directly or call our intake number, which is listed, and we will follow up with you after this as well. Please note, to receive your CE credit today, you will need to remain on the Zoom for the hour. Also, you will receive an email including the quiz and the survey. Please complete these to receive your CE certificate by email. And you should expect to receive that within 10 days. Okay, let me introduce our speaker for today. Dr. Magida, background in special education and expertise in executive functioning, helps in treating individuals with anxiety, depression, emotional regulation, difficulties, and/or attention focus issues. In addition, she enjoys partnering with parents as they develop new tools to diminish power struggles and establish healthy boundaries within the family system. Dr. Magida has presented in numerous venues on such topics as understanding executive functioning, how to avoid the dreaded power struggle, classroom management, and polyvagal theory and therapy. She has also created a parenting course titled Connection Before Correction. Before founding Therapy Etc., Dr. Magida worked as a special ed teacher in the therapeutic day school setting. She also served as the behavior intervention specialist for District 60 in Waukegan, Illinois, providing training and support to district social workers, psychologists, and administration. Dr. Magida earned her bachelor's in science in education from Illinois State University. She received her master's degree in clinical psychology with a counseling specialization and a concentration in children and adolescents from the Chicago School of Professional Psychology. She earned her doctorate in counseling education and supervision from Adler University. Welcome.
Hi, thank you so much for having me. Good morning, everyone. It is so nice to be here, and happy Friday, happy Pi Day to my fellow nerds like me. Um, so I hope you all enjoy pizza or pie today, because you have to. You have to. Okay. So, good morning, everyone. Thank you so much, Donna, for the introduction. The reason that I felt this presentation and this topic was needed is because in speaking with parents and educators and other therapists, and as we all, read what's new in the literature, we're finding that, I feel like we're going in a positive direction. I think concepts such as mindfulness and bringing awareness to executive functioning is extremely important. But I think that there's a lack of understanding of what is executive functioning, right? So what are these really, really important concepts and these things that are being talked about? What are they? And if we don't understand what they are, then we don't quite understand how to support it. And so sometimes, in those instances, when we find ourselves feeling ridiculously frustrated, continuously frustrated, or feeling stuck, I'm wondering if this may be part of the reason why. Okay, so our body is very attuned to our environment. Our autonomic nervous system is constantly scanning our environment, and it's a very primitive security system that our body has, and it's only capable of sensing one of two things. Our environment is either safe enough to connect, or it's not safe and we need to protect ourselves. And we can't establish connection with other people if we don't feel safe enough to connect with them, right? So, what does it mean to be dysregulated? Well, dysregulation means to be unable to control or regulate something in a way that is normal or expected. But remember, when we're talking about normal and expected, two things here. Number one, normal and expected based on social norms. So we got to keep cultural biases, in check, of course, but also expected based on neurotypical counterparts, right? So in this situation, we're talking about children, but really it can be through the lifespan, normal or expected based on other people in your age in that similar situation. And so we have a multitude, a continuum of emotions. And that's okay, right? We need to be able to respond adequately to the size of the problem. But our when we're talking about outbursts, it happens in a cyclical pattern, right? So think of a bell curve. At the bottom left, you have baseline. And this is the way that the kiddo um, regulates themselves, manages themselves within their environment. And at baseline, we're looking at functioning in three primary areas. We're looking at emotional functioning. How does the child talk to themselves? Right? What is that internal dialogue like? How do they treat themselves? What kind of relationship do they have with themselves? Social functioning. How do you talk to other people? How do you engage with others? Are you able to establish and maintain relationships? Um, and then lastly is academic or occupational functioning. Despite what might be happening socially or emotionally, are you still able to do what needs to be done? And sometimes there's a triggering event that can cause agitation. And as long as we are still within our window of tolerance, we can utilize a variety of coping mechanisms at this stage. At this stage, we can still we need to validate, right? We need to empathize, we need to normalize because that's going to diffuse, that's going to help the autonomic nervous system know that it's safe enough to connect, but you can still problem solve at this stage. But if the triggering event doesn't get repaired, right? If that sense of disconnect or lack of safety for whatever reason, right? It could be real, it could be perceived, um, continues, and the distress exceeds that window of tolerance, then we go up the curve here and we go to an escalating event, which can be verbal aggression, which can look like a lot of different things. Stomping, grunting, yelling. There can be mild physical aggression here, like throwing a remote control, knocking over a box of Kleenex, stuff like that. At this stage, we're going to decrease our language. We're going to we're unable to reason, provide logic to an emotional brain, right? That person is starting to really shut down. So, at that point, more um, visual cues, more proximal supports, things like that. But then if it continues to escalate, we get to an outburst. And that outburst is either a meltdown or a tantrum, which we'll speak more to in a moment. And at that point, you got to let it burst, right? While establishing safety, boundaries. We'll talk about that. But you kind of got to get through it in order to get over it. And then once you're at the back at baseline functioning, that's your opportunity for repair and recovery, to to repair the rupture in the connection that caused or led to the triggering event or the escalation of the triggering event. Next slide, please.
I'm trying to, it's not letting me. Hold on a second.
That's okay. Gotta love technology. So, when an outburst or a meltdown happens, remember that all behavior is communication, right? What we are unable to articulate verbally, what we're unable to transcribe from thought to word, we express, right? We express that. And so sometimes reading behavior as communication can be helpful, especially when that left logical, linguistic side of the brain is shutting down, and that emotional, sensational, sensorial part of the brain is super activated. So what tends to happen is that the adults in the situation respond to what they see. They respond to the observable behavior. But the observable behavior is a response in and of itself. Because underneath that iceberg, underneath that observable maladaptive behavior, what's really going on? You have your autonomic nervous system, sirens blaring, wondering, am I safe? Am I loved? Am I capable? Do I belong? Can I do things for myself? Are my thoughts valued? Do I matter? And those questions that I have listed there are very intentional. And oftentimes the question that the person has internally that they're seeking answers to is related to their stage of development. But that's another conversation for another time. But think Erickson, okay? All right, next slide, please. Okay, so we understand the outburst cycle. It's very important to understand the outburst cycle, but it's so important to understand the difference between a tantrum and a meltdown, because the function of those observable outbursts are super, super different. And if the function is different, the purpose is different. If the purpose is different, then the intervention needs to be different. So let's dive in a little bit more. Tantrums. Tantrums are controlled. Usually the young person is able to talk if they wanted to. In a tantrum, the young person is able to calm down quickly after the matter is resolved, after the distress is eliminated or they get what they want. The tantrum in and of itself is a purposeful action and would not exist without an audience. Okay? Versus a meltdown. Meltdowns are unregulated. the young person is unable to speak or receive information during this time. It takes time for them to regulate even after the issue is resolved. Meltdowns are not goal driven. Instead, they're actually a response due to feeling overwhelmed and overstimulated. And it only stops when they've tired themselves or a change in sensory input has taken place. So think a tantrum is I want what I want and I want it now. And a meltdown is I can't handle how big this feels. Even though it might seem small for us, right? Think a 3-year-old that has a complete meltdown if you give them the wrong color cup. That may have happened to me once or twice. I mean, right? How many parents wanted to just throw away all of the colors? I can't tell you how many meltdowns we've had over the wrong color plate or the wrong color cup. That's a meltdown, right? That at baseline, they know what to do. They know they can regurgitate what they should do in the moment, but no amount of shoulding is going to help them because they're unregulated. Next slide, please. Okay, so when there is dysregulation, when there is discord, when there is disconnect, we need to look at our expectations, right? Because if an individual clearly knows what is expected of them and what to expect of others, they're bound to be successful. And so those expectations need to be clear, they need to be concrete, and the individual needs to know what the resulting consequences are going to be for their choice or their action. And in this context, I mean consequence behavioralistically speaking, not the negative connotation we've attributed to the word consequences. I mean literally antecedent, behavior, consequence. There are positive consequences, there are negative consequences, clear and concrete consequences of what would happen if they choose a specific behavior. So, when I'm sitting down with a client or a student, and I would say, all right, in this situation, tell me what happened. They'd say, blah, 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 blah happened. And I'd say, okay, so what are your choices here? Like, what are all the choices? And they say, I could have walked away, I could have shared, or I could have punched them in the face. You're absolutely right. All three of those options are choices that you could have made. There are clear and concrete consequences for each one of those choices. Is the preferred outcome the desired outcome? Are you going to get that with the choice that you're making? And then be accountable. Be accountable to yourself, be accountable to others. Follow through. Don't say something if you don't mean it. Okay? And lastly, focus on what to do, not what not to do. So that means that expectations need to be stated in a positive way. And often it helps to explain why. So we don't climb up the slide because I'm worried you're going to hurt yourself, right? Or that's explaining why. But instead of saying, stop that, don't do that, don't climb up the slide, we say, we go down only. Okay, but why? why does it matter? Why do expectations matter so much? And how do executive functioning skills and brain development play into this? Well, twofold. One, we know that the prefrontal cortex, which is responsible for managing all of our executive functioning skills, is the last to develop and the first to regress, right? Because our brain develops from back to front and regresses from front to back. So our prefrontal cortex, which is a very, very important part of our brain, isn't fully developed until mid to late 20s. And that is inhibited by any processing disorders, cognitive impairments, traumatic brain injuries, seizures. And when I say processing disorders, I mean all of them: sensory processing disorder, auditory processing disorder, visual processing disorders, anything that causes your prefrontal cortex to not be able to function at its full intended, normal, and expected functioning. So, if we don't have full access to it, we can't adapt and respond. So, number one is the development part. Number two, when our autonomic nervous system is bracing ourselves for protection, our amygdala turns on, our prefrontal cortex turns off or quiets down. So, if we're already functioning at 80% because of a developmental or a neurological deficit, and then we add to that feeling unsafe, we really don't have a lot of control over the things that we really need to in those hard moments. What are executive functioning skills? We talk about it a lot. They're important. The prefrontal cortex houses them. We know that. The prefrontal cortex doesn't fully develop until your mid to late 20s. I feel like we all know that, but do we know what it actually regulates and how it does it? So, generally speaking, it can be divided into two categories. One is thinking and problem solving. That's the cognitive part. That's planning, prioritizing, organizing, managing your time, working memory, all that fun stuff. The other side is the implementation, right? The implementation is the behavior part. It is the performance part of the skills. So, response inhibition, emotional control, sustained attention, task initiation, flexibility, goal-directed persistence. When we're thinking of ADHD, when we're thinking of stimulants, right? When we're thinking of medication, we are treating the implementation side of the slide. But we still need to support the cognitive side of executive functioning deficits. And so there's the skills deficit part on the left and the performance deficit part on the right. Okay, so typical, normal, expected executive functioning development. In elementary school, you're learning to pay attention. You're learning to control your behavior and your impulses. You can start following basic 2 to 3 step directions and following different subsets of rules. For example, there are rules at home versus rules at school versus rules at the library. In middle school, you start learning to think ahead and have goal-directed actions, and you're starting to learn critical thinking skills and problem solving, managing and following a daily routine, and modifying your behaviors um, in different environments. So in elementary school, we know that there's different expectations, but in middle school, we also understand that within those different environments, there are nuances. So, we can be silly at recess, but the way we're silly with our friends is not the way we're silly with an adult. Okay. In high school, we start learning to think and behave with flexibility and understanding that not only do situations have nuances, but people have nuances too. We can start organizing and planning projects, activities, and start to adapt more easily and independently by deepening self-awareness and how they view themselves and how they fit within their environment. Then in college, we start using those executive functioning skills to be independent, to be productive, functioning adults without the supports that we're used to. We need to self-monitor and we need to be consistent. And then in adulthood, we need to consistently use those executive functioning skills to establish a sense of balance between work and your personal life, and within your personal life, balance too, with all the different hats we wear as partners, as parents, as professionals, and then using those strategies to set meaningful and achievable goals. Okay, so what happens when our expectations are clear and consistent, but that discord and that disconnect and that discomfort continues to happen? We need to do what I like to call the R test. Are the expectations, as clear and as they may be, are they reasonable and realistic? What does that mean? So think of kiddos having three ages. We have our developmental age, we have our chronological age, and we have our cognitive age. And for this, I often use my son as an example because he's probably the most perfect case study for this. Chronologically, he is 10 years old and he's in fourth grade. Cognitively, he is not gifted, but highly intelligent and is currently working on like fifth grade math and like sixth grade reading. But developmentally, his social emotional skills are, so he's in maybe of a first grade level, and so he needs maximum supports in order for him to be able to reach his full potential because of his executive functioning skill deficits. Okay, so if our expectations are super, super duper clear, and then we need to go to the R test. Is it reasonable and is it realistic? About like 8 years ago, I was in a clinical book club because if celebrating Pi Day at the beginning of this presentation wasn't enough of an indicator that I'm a geek, I really, really enjoyed being in a clinical book club with other practitioners. And it forced me to read books outside of my niche. And we met monthly. Each month we read a new book, and then we would meet for like, I think an hour and a half, and we'd connect, and it was wonderful. And I'm an avid reader. I love reading. So, if somebody were to invite me today to a clinical book club that met monthly, it's a reasonable expectation that I can handle the the planning, the prioritizing, all of the things necessary in order to be a productive contributing participant of this book club. But since then, I've had kids, my business has grown, I have a lot more on my plate, and even though I can realistically read a book a month and go to a meeting once a month, it's no longer a reasonable request. I cannot reasonably add that to my plate. And the expectations can be super duper clear. It doesn't matter. I will not be successful if you put me in that same situation today. And that means it doesn't pass the R and R test. So when there's discord, we check our expectations. If our expectations are clear, we do the R and R test. If we don't pass the R and R test, we need to go back to our expectations and keep in mind, are our expectations that based off of what is normal and expected, or that based off of the person in front of us? Right? It is not reasonable for me to expect my son to always produce that that another 10-year-old does. And just because cognitively he understands concepts that are more advanced than a 10-year-old, it is not reasonable for me to expect him to understand nuances of advanced things that a 12-year-old does when he's 10. But also, my expectations of him need to be informed by what he developmentally is capable of, right? Because of his executive functioning skills. And so if I don't have reasonable and realistic expectations based on those combination of factors, then I'm setting both of us up for failure. So now what? Okay. So what do we actually do to make progress in this area? When there is a stressful event or a triggering event, remember that bell curve that we saw on the slide regarding the outburst cycle? It feeds into a feeling, right? Think CBT. That child experiences an emotion. Their perception of the event is based on a number of factors, their life experiences, the situation, how grounded they are in the moment, all those things, but it leads to a feeling. That feeling leads to a behavior. That behavior is observable. That observable action can become the adult's triggering event. The way that the adult reacts can be the catalyst for another triggering event as well. So that's why it's so important for adults to know when to pick your battles. Because if you're going to perpetuate this cycle, you're just going to find yourself in unnecessary power struggles. The best way to end that cycle is to be reasonable. Make sure that those expectations are reasonable based on their developmental ability. Give warning, scaffold those supports, acknowledge the child's feelings. Remember at the beginning, I mentioned validating and normalizing and bringing empathy to the situation is going to diffuse feelings of protectiveness and help engage in connection. Another way to do that is by offering choices. When the young person feels that they have choice and they have autonomy, then they feel safer. Clarifying consequences, again, remember that that's not always a negative thing. It's just understanding what the outcomes are to various behavioral choices. Give the young person time to comply. Because number one, when there are deficits in executive functioning, then the processing time is greater. And additionally, when we're in distress and we further have limited access to our prefrontal cortex, it can further inhibit or diminish that processing time. So give time to comply and then follow through. Be accountable, be consistent. You be reliable. The adult be reliable, and follow through. I jokingly tell parents that consistency beats accuracy. Because even if you don't have the best response, having a consistent response is better than having the young person never knowing what to expect. And lastly, after the issue has been addressed, move on. If an issue happened in the morning, then after school, don't keep hanging it over to the young person's head. If something happened at school and there were already consequences given, I'm generalizing here, but if there are already consequences given and the child has made reparations at school, then what is the purpose? What is the benefit of adding consequences at home also? Teach the child how and when to move on. So, by empowering and encouraging, we can really help to diffuse those power struggles. When a child is having a maladaptive behavioral response to a request, to a direction or a redirection, then it can be helpful to pause and ask, how can I give this child more power in this situation? Now, there are times where you don't have time. You don't have time to wait for them to tie their shoes or to try to buckle themselves. But and that's okay. That is okay that sometimes they don't have choice. But how often do they? Right? If the expectation is to get dressed, then give them choice, which will make them feel more in control, which will make them feel safer, which will make them feel more heard. It sounds like some addictions adults have. Yes, adults can have tantrums and adults can have meltdowns too. Sorry, I just saw the question in the chat, and it says it sounds like some of the grown men I work with in addictions. Remember, addiction changes the structure of the brain and does, in fact, impact executive functioning. Adults can definitely have tantrums. They can also adults still have ADHD, right? We learn how to live with it, but we still have it. Children with sensory processing disorder will always have sensory processing disorder. It just becomes less pervasive, but it's still there. So, or think of moms, like being touched out or overstimulated and then snapping. So yes, adults can both have tantrums and meltdowns. Choices, not orders. This is a little bit of what I was speaking to on that last slide with empowering. Make sure that the choices you are offering are acceptable, that they're broad enough to not be overly autocratic, like making it seem like the choice isn't actually a choice. um and punishments can't be an alternative option, right? So and that's where we use consequences with that negative connotation. So I want to reframe that here because um I, what does it mean to come from a positive approach? It doesn't mean to be passive. Positive parenting is not passive parenting. That that's neglectful in a sense. Um, but it's not saying do this or else, right? It's saying you can choose A, you can choose B, and if you don't choose either of those, that's okay. I'll choose for you. You might not like what I choose, but this is what you can choose right now. And so saying and make sure I think it's the next slide. Yes. And make sure that the choices you are offering are mutually beneficial. So in the school setting, we it would be called a forced choice menu. So we would do an interest inventory to identify what the young person's interests are to see if we can figure out a strong enough motivator to use for a positive reinforcement system or a token economy system or what have you. So then, based on those interests, we would say, okay, well, what's realistic and reasonable in a school setting? Right? We're not going to watch an entire 30-minute episode of something, but maybe we can listen to a 2-minute song. So anyway, so you choose a bunch of different options that are okay if they choose it. And that's a forced choice menu. You are forced to choose from this menu of options, but anything on this menu is totally okay. Right? And so when power struggles feel like someone has to win and the other person has to lose, reframing that by finding a win-win solution is where everybody feels like they get what they wanted. If the purpose is compliance, then is there a way that we can promote compliance through connection, through empowerment, through choice, through speaking to the child where they're at in a method and a manner that is respectful and elicits a response that you want to have, right? So, this is fresh in my mind because we had quite the little meltdown yesterday at the house when we had to turn off iPad. And uh it was 5 minutes, 2 minutes, 1 minute. Okay, we got to turn off iPad. And I got met with and all sorts of grunting and nonverbal stuff that just drove me up a wall. And I knew that how I responded in that situation was either going to escalate him or not. Right. So I said, you have a choice. You can either get off of iPad now and um we can do this fun activity, or you can choose to not get off of iPad now. We won't be able to do this fun activity and you're going to lose iPad for tomorrow because your choices are showing me that you're unable to handle this privilege. So I'm not taking iPad away from you. Your choices are showing me that you can't handle this privilege. Okay, so as a recap, I call this dysregulated emotional response. When you look at your D's, your E's, and your R's. Discord, behavior is communication. When the size of the response doesn't match the size of the problem, there is misalignment or misattunement. Okay, so then, wondering if there's research. Oh, yeah. So you can utilize a token economy tool in a healthier, safer way than its ABA roots. I do not agree with the way that I don't love ABA and I have feelings about that, but that doesn't mean that that Skinner was wrong, right? It's just the way that intervention is used isn't great, but we can still use them um, to shape behaviors, but not to treat children like dogs. Also, I don't agree in using food as incentives because food is a necessity, and I don't feel like that's something that should be earned. Anyways, sorry, I just wanted to speak to that question. So DERs, Discord expectations, ensure that there is a concrete understanding of what the young person can expect from others and what is expected of themselves. And then the R test, are my expectations both reasonable and realistic given the young person's age? And remember that age can be viewed as chronological, developmental, and cognitive. Yes, so sorry. Wondering if there is research that supports token economies for neurodivergent children. Everything I have read suggests that token economies have ABA roots, which is largely considered to be traumatic by the autistic community. I agree. The way that uh, many ABA practices are. ABA was designed for very low functioning individuals with severe cognitive impairments in addition to their autism that were preparing for vocational training, for line work or that kind of stuff. So outside of that, I don't feel that it is appropriate to use ABA. I'm so sorry. I didn't realize that you all couldn't see the questions that I was responding to. Does anybody else have any questions?
Oh, okay.
Oh, thank you.
Did you do this one already? Why do we have to let the outburst burst? Is there a negative aspect that it is not allowed, or is it just impossible to stop from happening at that point?
Um, that is a great question. Why do we have to let the outburst burst? Because if you try to engage at that point, you're just feeding it. You are just adding emotional fuel to the fire. If you are interjecting, um, if you're choosing, okay, let me say this. If you're going to choose to intervene to help the outburst burst, don't do it with language. You can do it with a hug. You can do it by sitting down and just breathing next to the child. But if the child doesn't want it, if that calming modeling behavior isn't regulating them, then you need to give them space and you need to let them get through it because otherwise you're just engaging in unnecessary power struggles. There is no winning at that outburst state. Somebody said, would it be possible to have a cheat sheet handout that we could use reference? I have several clients that would benefit from this, and I would as well as a parent. All of these slides are going to be shared with you, so you have all of these notes and strategies to take with you. This is very informative and can definitely be geared towards some of our men in addiction and early recovery. Yes, this can be geared towards anybody that has difficulties with executive functioning. Children, addiction, um, or even in the workplace, adults that have difficulties with executive functioning, supervisors knowing how to supervise them. And also it can be translated to the dementia, um, population as well, because when they're regressing, it's their executive functioning, it's their prefrontal cortex that regresses first. So this works with the geriatric population as well.
Hey, Michelle, another question is, what if a child consistently asks for food when dysregulated as a calming strategy?
Okay, then when we have a maladaptive behavior such as relying on something like food to soothe us, instead of being able to self-soothe, we need to take a pause and consider the function of the behavior. So let's think scientifically about the purpose and the function of that behavior. What happens when we eat comforting food? What chemical is released? What real life exercise or coping calming strategy can also release that chemical, right? So it's bringing awareness to the fact that they are relying on a maladaptive coping mechanism to deal with the dysregulation. That is awareness, recognition, skills acquisition, and then you have the performance piece, which is taking what we know at baseline and implementing it when life happens.
Another question, Michelle, is what if during the outburst the child is engaging in hitting? How should this be addressed, especially if the young child won't give space?
That is a great question, and it's actually a very real conversation that needs to happen. There are understandably many laws that protect children from abuse. Unfortunately, there are zero laws to protect parents from abuse from their children. And that can be really hard. When you have a young child that is dysregulated, an autistic individual, or it doesn't have to be autistic Down syndrome. I mean, I've worked with so many kids over the years. When they become physically aggressive, and you can't help them regulate, then you need to separate yourself. If you are unable to separate yourself, then you can either have a calm down corner or a calming space. I do not like to use bedrooms as a place to calm down, because I don't want children to ever associate going to sleep negatively or have a negative connotation. But if children choose to go to their room to calm down because they themselves find that to be a comforting space, that's very different. And I just lost track of the question. Sorry, Donna.
Like if the
Oh, they're
child
aggressive.
is hitting, yeah.
Okay, so if you can physically remove yourself, um, go like going to a bedroom and closing the door, it's going to be really hard, because they're going to have to that outburst is going to have to burst first, and so you're going to have a lot of screaming, crying, banging on the door, and you can't engage. You can't engage. You can put the young person in the backyard and say, if you're not going, respectfully, right? Make sure that they have whatever they need to be safe and comfortable outside, but say, hey, you're not being safe in here. You're not treating this space with kindness and respect and with safety. So if you're not going to give me space and you're not going to respect this space, you can go outside. And that's a very general answer to a very nuanced question that it's hard. It's really hard. I say that I use my son as an example a lot, and this is him, right? So he was diagnosed with ADHD when we started noticing something was different when he was 18 months. Really started impacting his ability to function in social settings at the age of 3, and was diagnosed at the age of 4, which was really, really hard for me as a parent, because when we think about ADHD, we think about 11-year-old boys that just can't sit in their seat and, are being class clowns because of whatever, insert whatever stereotype here. But in addition to the severe ADHD, he also had severe sensory processing disorder and anxiety. And so his his meltdowns are extremely physically aggressive and volatile. And I would literally sit at the foot of the stairs, protecting myself with a couch cushion because there was nothing else I could do.
And kind of in addition to that, like one of the questions was, can you go over some self-soothing and emotional maybe regulation skills for before the outburst to prevent maybe it from getting to that intense level?
Um, when we talk about emotion regulation tools and strategies and coping strategies, the reason there are so many is because not every single one works for everybody, right? So, this leads into another conversation, another topic I would love to explore. Is it sensory or is it behavior? Right? So I'm really generalizing here. Behavior, tantrum, sensory meltdown. If it's a sensorial meltdown, then the specific coping strategy you use is geared towards the sensory system that is hyper or hyposensitive in the moment. So, do they need deep squeezes? Do they need to spin? Do they need to hold an ice cube in their hand? There are lots of different tools and strategies because they, just like medications, right? There's like 50 different SSRIs because they all speak to different neuroreceptors. Different coping strategies speak to different needs. So, is there a quick fire answer? This is what works well? No. It's just the fastest thing you can do to regulate the system, but what is regulating to me might not be regulating to you. For example, um, when adults are like calming babies, they go shh, and I hate that sound. I hate the shush sound. I couldn't do it, and I don't like to hear it. So even if that was soothing to my child, um, they were not going to get that from me. They'll get vibrations, they'll get bouncing, they'll get humming. I'll hum. I did that, and they would feel the vibrations, and that was really soothing. But I can't shush. I hate it. It does not feel good. Um, yeah.
So I know we're at time, and there's another like a couple questions in the chat, Michelle, but I just wanted to remind everyone that you will get in your email the quiz and then the survey. If you could please fill those out, you will get your CE certificate within 10 days. Obviously, if there's an issue and you don't, please feel free to again reach out to myself or Lori, and we can help with that. I know one of the questions Michelle was asking for your contact information. I don't know if you want to put that in the chat. I know, like Michelle had indicated earlier, the slides will be sent out.
Yeah, and I can do other presentations, other topics. I do one-on-one consultation and supervision. And I also have a little bit of time. I'm happy to stay on for about another 15 minutes to answer any additional questions if you'd like.
So one of the questions, okay, would it be possible, did you already answer this one, to have a cheat sheet handout that we could use as a
Oh, yep.
reference?
I said
Right?
I read that and everybody's
Okay.
getting the slides.
That's what I thought. Okay. Which ones did we not get to? Oh, if a patient's threatening to leave residential because he doesn't get his way, I may have, like the Julie said, I may have a way of handling, but I'd just like to hear your thoughts.
Julie, if you're still on, it would be really helpful if you're telling me about an adolescent or an adult residential treatment setting or patient.
I think she was talking about an adult because she was
Okay.
talking about men in addiction and early
Okay.
recovery.
Okay,
Yeah,
thank you. I remember somebody talking about mental rejection, but I couldn't remember who it was. So,
and she's still on, she said.
oh, hello. Okay, so if the person is saying, I'm gonna, what is it? What is it? Threatening to leave if they don't get their way. Basically, the behavior is saying, I don't feel in control. And I am feeling overwhelmed by the lack of control that I'm feeling. And I don't like the situation, and so I'm going to assert the only control I have, which is to make this threat. Now, that is a choice that they can make. I pretty sure, right? Like we don't hold people involuntarily, unless legal, blah 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 blah. But generally speaking, that is a choice that you can make. Is that going to serve you? Right? But I wouldn't go to that yet. First, I would say I would meet them where they're at. I would validate. I would use empathy to help diffuse as much as I can. And I would say something along the lines of, I hear you. You are not happy and you're like ready to leave. And then I would encourage them to communicate what's going on. If leaving is what is best for you, and leaving could be completely leaving treatment, finding a different program, whatever it may be. If that's what's best for you, I will be your biggest advocate. But talk to me. Tell me, why do you think leaving is the best choice for you? And if you can have a conversation, and then also, when I was talking about the outburst cycle and I talked about rupturing the repair at the recovery end of the outburst cycle, I do an entire thing about the actual steps to repairing that. And some of the steps I'm speaking to right now are the beginning steps of that interaction. If anybody is familiar with therapeutic crisis intervention, like TCI, um, they do a really great rupture repair thing called the life space interview. And I did this training in 2008 when I got my first teaching job because uh, that's what that school used. And then, CPI is also really popular. Is it LSI now? Anyways, TCI, oh, life space interview, LSI. Yes, sorry, Sierra. The LSI, which is the life space interview, is a technique taught at the TCI training, and that really, really helps to diffuse.
Thank you guys all so much for coming. Feel free to let us know. And again, you should get the quiz and the survey in your email. I know someone said it went to their spam. If it does, or if you don't receive it, feel free to reach out and we can ensure that you get that. Thanks, everyone.